Most esophageal cancer patients don't know they have the disease until it's too late. One of those patients was my father. His battle remains the driving force behind my mission to raise awareness, because early detection can save lives. It's the fastest growing cancer in the United States, with a new case diagnosed every 31 minutes. In 1999, Bart Frazetta of Manalapan, New Jersey, was one of them.
I got a call from my doctor in the afternoon. He asked me if I was sitting down, and I said, sitting down, why? Why do I need to sit down? He said, well, because you have cancer. I said, cancer? Cancer of what? He said, the esophagus.
Bart had suffered from gastroesophageal reflux disease, or GERD, for as long as he could remember, but he never thought it was anything serious. Until the day he found out his years of chronic acid reflux may have caused his cancer. Dr. Raja Flores was a thoracic surgeon at Memorial Sloan Kettering Cancer Center in New York when Bart became a patient.
The danger with reflux is that a number of patients will be predisposed to getting something called Barrett's esophagus. And Barrett's esophagus is a precursor to developing esophageal cancer.
Barrett's esophagus isn't the only risk factor. Others include age, gender, smoking, being overweight, and drinking alcohol.
They told me what I had to do with chemo, which was 24 hours a day, 5 days a week, and then radiation during that same 6-week period, and then a 7-hour surgery. And then after all of that, I had a 5 to 10% chance of living 5 years. So you sit back and you say, well, is it worth going through all of that?
Bart knew he was in for the fight of his life, and with the help of his wife Ginny, decided surgery was his best option. Surgeons removed the tumors and diseased tissue from Bart's esophagus and surrounding area during an 8-hour procedure.
Post-surgery, I felt there was a need to do something, to give something back to the institution that did my surgery and to the doctors that caused me to be here today.
Memorial Sloan Kettering's patient-to-patient program connects newly diagnosed patients with a survivor to support them throughout their cancer battle.
Bart routinely spoke to all of my patients who had esophageal cancer and esophagectomies. And I found him extremely helpful in guiding these patients through their surgery.
It expanded to a point where I now see patients for about 9 doctors, 9 surgeons from different institutions. And over the last 10 years, I've seen over 900 patients.
When you do the outreach to the patients, do you find that they really don't know a lot about the disease and what to expect in terms of the treatment plans that doctors are discussing with them?
For the most part, yes. You find that they have also gone to the internet and literally have been destroyed by the information they've gathered from that.
Bart realized there wasn't enough information out there about the disease. So he founded the Esophageal Cancer Education Foundation to raise awareness and fund research for early detection and treatment. The ECEF has funded research in some of the country's leading cancer centers. And in 2011, with the help of advisory board members like Dr. Flores, they published a guide for patients going through surgery.
If we can shine a light on this disease and save somebody as a result of what we do, that's what it's all about.
For more information or to find out how you can get involved, log on to fightec.org. I'm Kimberly Guilfoyle, Fox News.